Serious possible side effects include memory loss and confusion. Memory loss is reported by some, but the evidence is inconclusive. Therefore, the debate continues over whether statins may have damaging effects on brain function. Approximately 17% of patients who take a statin experience some mental confusion. Although this is not an extremely high level, it still is enough to warrant trying to lower high cholesterol levels with better nutrition and lifestyle changes. Elevated blood sugar levels and increased risk of diabetes. It is now accepted that there is an increased risk of type 2 diabetes in statin users. One study reported a 9% increase in risk. Another reported a 13% growth in risk. The reason for this is that statins appear to promote diabetes by interfering with insulin secretion by the beta cells of the pancreas and by lowering insulin sensitivity. Liver damage. Taking statins can result in elevated liver enzymes, which is a sign of the liver working harder and may cause liver damage. This side effect has been reported by some statin users. However, once again, the evidence is inconclusive since many people experience no liver problems while using statins. Muscle pain or weakness. Some individuals who take statins develop muscle damage. In extreme cases, the body may release the protein myoglobin, which can cause kidney damage. The most common adverse effects of statins are myopathies, reduced muscle function, which may be due to impaired energy production in the mitochondria of the muscle cells. These side effects include muscle pain, myalgia and myositis, and a severe breakdown of muscle called rhabdomyolysis. Rhabdomyolysis can also lead to kidney and liver dysfunction. More severe muscle breakdown occurs rarely and is usually reversible upon stopping the drug. In a small number of cases, muscles can be severely damaged. Muscle damage caused by one statin, cerevistatin, or Baycol, was severe and widespread enough, several hundred deaths, for it to be withdrawn from the market in 2001. Cancer. There have been numerous scientific studies about the use of statins and the risk of cancer, but the evidence is conflicting. Kidney damage. A study examining Canadian healthcare records for 2 million patients who had been newly prescribed a statin found an increase in the incidence of hospitalization for acute kidney injury during the first 6 months of statin use. This was worse with high-potency statins in particular. Again, this is due to the increased chance of the body releasing the protein myoglobin, which can damage the kidneys and, as mentioned earlier, also can cause muscle pain. Due to the adverse effects of statins on skeletal muscle, there is evidence that statins may also blunt the beneficial conditioning effects of aerobic exercise. The likelihood of muscular side effects depends on the dose of the statin, and these side effects are more prevalent in physically active patients. A team of researchers from Japan and the U.S. has compiled and described possible molecular mechanisms by which statins could accelerate heart disease. The authors make the argument that the abnormalities caused to the energy production machinery in skeletal muscle imply that heart muscle could be similarly damaged. Cataracts. Previous studies that have looked at the link between statin use and cataracts have produced conflicting results. Some say there is an increased risk, others say there is not, and some show inconsistent associations. In light of this, doctors are urged to carefully consider the risks versus the benefits of statin use, especially for prevention. As with other side effects, further studies are needed. Women and statins. All agree that both sexes with heart disease should consider statins, but discussion continues over whether women at moderate risk of heart attack and stroke should take statins. Studies of men and women have shown a reduced risk with statins for both genders. However, the number of women participating was insufficient to produce definitive results. Until a large-scale trial assesses effectiveness in moderate-risk women, statins should be avoided in most lower-risk women. But for those at moderate risk, the drug should not be ruled out. In day-to-day living, these side effects can cause some users to have difficulty climbing stairs, suffer from constant fatigue, and have sore muscles, especially after activity. These side effects must be noted if they persist or worsen. The drug dosage must be adjusted, or the drug use may have to be stopped. However, this is not the case for most people taking statins. If you have elevated cholesterol, changing your nutritional intake and getting off the couch should be your first course of action. Medication is unnecessary in most people who make the appropriate lifestyle changes. A nutrient-loaded choice of foods such as cruciferous vegetables, nuts, beans, and berries work synergistically to bring LDL cholesterol down and restore the arteries back to proper operation. Clean, powerful nutrition has been found to have the ability to reduce cholesterol by 33% within 2 weeks. Unlike taking a statin while continuing poor eating habits, a diet based on vegetables, legumes, nuts, seeds, fruits, organic grass-fed meats, and adequate water intake for proper hydration delivers multiple benefits, dramatically lowering your risk of heart disease, annihilating atherosclerotic plaque, while causing cholesterol levels, blood pressure, and inflammation to plummet. A healthy lifestyle of smart eating and the right fitness routine also gives your body the strength to ward off diabetes and cancer, and provides you with an ironclad immune system. Also, nutritional supplements are an essential part of the equation. Statins are potentially toxic to the mitochondria because they may deplete the body's levels of coenzyme Q10, a critical component of mitochondrial energy production. Cardiac muscle tissue is especially vulnerable to coenzyme Q10 depletion because of its high energy demands. Our clinic will monitor your levels of this vital substance and recommend supplementation as needed. However, if, in spite of your positive lifestyle changes, your cholesterol levels stubbornly remain high, statin use may be warranted. In that case, the previous information should allow you to make an informed decision. By deciding to slow down and potentially halt the aging process, you are aware that aging itself plays a huge role in all afflictions, including increased risk of heart attack, stroke, and elevated cholesterol levels. You can choose to remove the cause or treat the symptom. Treating the symptom with statin drugs does not reverse heart disease and carries the risk of adverse effects. Removing the cause with a medically supervised growth hormone replacement therapy, combined with health-promoting nutrition, physical fitness, and stress-reducing lifestyle changes will not only reduce cholesterol, but also reduce blood pressure, heart disease, and deliver reliable protection against diabetes, dementia, and cancer. We have all bases covered. The whole program. A synergistic blend of hormone restoration to your youthful levels. The right nutritional plan. A fitness routine personalized for you. The latest advice on health-promoting supplements, and medical supervision of any condition that may require prescription drugs. We leave nothing to chance. If you found this video informative, please press the like button and subscribe to the channel. Visit our website in the description to learn more about health and wellness regarding hormone replacement therapy.